When Heinrich came and presented the product, I was amazed by what he had to show and the endless opportunity the SAA could offer to help us, to direct us in diagnosing. And it's not all about the diagnosis, but it's diagnosing, getting the best of it, but also helping with adequate treatment. The part I like when Heinrich came was not just selling a product. It was his keen interest in the science behind SAA and in trying to improve the field, trying to gain knowledge. My goal, my vision, if I can call it that way, is to incorporate serum amyloid A as part of a diagnostic workup with every horse for which I need blood to help me, or blood analysis to help me getting to the diagnosis. We get these horses, let's say in a respiratory field. Horse presents with respiratory signs that can be associated with a pneumonia. It's important for me to know, well, does it look on the blood work like this is an infectious condition versus an environmental inflammatory but non-infectious condition? That's truly going to drive my treatment. And that's why I see a lot of benefit in using the SAA in this specific instance. We are just in the process of looking at correlates between clinical correlates and what I call conventional hematological parameters, looking at nucleated cell count, neutrophil count, lymphocyte count, fibrinogen, total protein, and SAA. But so far the trend looks like SAA, it's a very accurate indicator of early inflammation and even a better indicator of inflammatory condition due to infection. I feel like every 5 or 10 years we have this new tool that comes up. I mean, it used to be ultrasound and then digital radiography. Now we have CT. These are mainly diagnostic modality. I'm an internal medicine person, so I'm looking at tests that help me support or rule out a diagnosis. And we have a lot of new diagnostic tests with many infectious diseases. And when I look at SAA, this has been really an area that's been missing. Is that, and it's all the time, that lack of time between when it happens to the time we see clinical disease in that early stage, in that infancy of the clinical presentation. What markers do we have to help us support a diagnosis, to help monitor response to treatment, or just to look at that healthy horse that clinically is healthy, but is internally handling or dealing with a low-level infection, and having tools to monitor. So looking at the assay, monitoring horses, high-risk horses while they are healthy, monitoring their overall health status, I think it's amazing opportunities. Even better, I always thought that as a clinician, I need to rely on my stethoscope and my thermometers and my clinical ability. And I'm ashamed to say that SAA is actually beating my clinical capability. Not in all the cases, but definitely in these early stages where that horse looks healthy, but is in that early stage of developing clinical disease. So a tremendous advantage.